The title of the topic is Building the Digital Health Ecosystem of India, Opportunities and Challenges. Professor Sarbadhikari is a physician and health informatics educationist. He is regarded as a pioneer in spreading awareness of health informatics in India. He has a wide and varied experience in government, healthcare, technology, and academia in India and abroad. He has numerous international scholarly publications, including books. Currently, he is an expert roster for digital health at WHO, and IMA honorary professor and distinguished fellow of HitLab. Please welcome Professor Sarbadhikari.
Good afternoon, everyone. So I am honored to be back here again. I'm doubly honored because I think it's going on simultaneously. So in the new normal virtual world, we have really a bigger audience. Of course, time zones may not be very convenient for everyone, but I think we'll take something for something. So I'd be like to share my screen. Let me see. Can you see my screen?
Yes.
Okay, so the topic is building the digital health ecosystem of India. And we are really going to look at the various opportunities and particularly challenges, how to overcome them. So I'll give a brief introduction about the digital health landscape in India. Then I'll talk about some of the current and projected state of digital health industry in India. Of course, we are all familiar with and fed up with the disruptions during this COVID-19 pandemic. But there have been a lot of fallouts, particularly in the digital arena. Then we'll talk about the National Digital Health Mission. And particularly, I'll stress upon the role of multidisciplinary interactions, because it's now no more an individual's effort which matters. It's really a team effort. If you really want to progress, we want to get better health outcomes, it has to be a team effort. I'll share my take-home messages and, of course, questions and answers. Most welcome. This is sort of the point of time where I take the start, or rather the push. So the National Health Policy, this is the third edition, the National Health Policy of India. The third edition was published in 2017, so about 3 years back. And as you can see here, the National Health Policy clearly states that there's going to be a digital health technology ecosystem. And for facilitating that, statutory authority, the National Digital Authority, will be set up. Subsequently, there has been a lot of work going on it, and even I've had some expositions related to this. Digital health also gained momentum globally, and so the World Health Organization started the division of digital health in February 2019. And now they're coming up with the global strategy for digital health 2020 to 2025, where digital health is basically defined as the field of knowledge, as you can see, marked it here. So the field of knowledge and practice associated with the development and use of digital technologies to improve health. That's a rather broad definition. It's an umbrella term which actually encompasses all the things which can come under e-health, mobile health, telehealth, and all these things put together, and many more. So one of the things which is expected from all the countries, we need to have a national e-health strategy or a digital health strategy. So India came out with the National Digital Health Blueprint. This was formally released last year. That was about a year back, November 2019. And within that, the implementing arm was called the National Digital Health Mission, which was formally launched this year in 15th August. But before going into that, I'll just have a look at where do we stand as far as digital health as an industry is concerned. So healthcare market is expected to grow. And healthcare information technology is also showing an upward trend. Diagnostics market, this is another area where a lot of digital interventions are coming in a big way. And telemedicine market was expected to grow about 20% or so, but COVID made it otherwise, and the growth became much more. In fact, I think about a few months, within 3 months of the release of the telemedicine practice guidelines in India, there has been a rise of more than 500% for the healthcare teleconsultations. And as you can see, the majority are first-time users. So a lot of things have happened, and some of these changes are obviously irreversible. So COVID-19 is being called as the chief transformation officer globally. So that led to a national lockdown across countries, which led to the physical mobility restrictions. And obviously, for communicating, digital modes were the only option left. Also, because of the fear of contact, there has been more indirect robotic applications everywhere, including healthcare and education and healthcare. These are the two sectors which have been forced to go much more digital than we would have otherwise thought of. So digital health has increased. The adoption, the diffusion is going up. Government of India brought out the telemedicine practice guidelines, first by the Ministry of Health and Family Welfare, followed by the Ministry of the Ayush. This happened in March 2020. And subsequently, it was also notified in the Gazette of India. Then government as well as private players, academicians have used mobile apps and dashboards to track and trace the progress of the COVID-19 pandemic. And as I've already said, the National Digital Health Mission has been launched in August 2019. So what are this is the Gazette notification, screenshot of that. So what are the features in the National Digital Health Mission, or the NDHM? This definitely tries to address the SDG 3 goals. And therefore, accessibility, affordability, education, empowering wellness, portability, privacy, security by design, all these are inbuilt features. And the National Digital Health Mission is providing the integrated digital health infrastructure. So the key building blocks, first is the health ID, then there's the DigiDoctor, there's the health facility registry, personal health records, telemedicine, and e-pharmacy. Of course, telemedicine and e-pharmacy is going to be rolled out subsequently. In the initial pilot, the first 4 have been already started in 6 union territories. And it's expected that the National Digital Health Mission will bring together disparate stakeholders and radically strengthen and change India's healthcare delivery landscape. One of the good things which this NDHM has brought in, one of the opportunities, and this is where a lot of stakeholder interactions are going on, public-private partnership. We talk about it, and often it doesn't work well because of the mutual distrust. But this NDHM sandbox environment has given that opportunity, and various private players are also taking advantage of that, coming into it, developing the APIs through which they can be associated with the National Digital Health Mission right from the beginning. It's open to everyone. So whether it's a healthcare service provider or a hospital or a healthcare software vendor, anyone, whoever wants to build this application programming interfaces based on the National Digital Health Mission are welcome. So the registration process is also fairly easy, and once you get access to it, you can test the systems that you're going to develop and how they're interacting with the overall backbone infrastructure, the technology infrastructure that's there in place. So challenges, I think we're all very familiar with. In India, internet connectivity is a huge challenge, but definitely it's spreading a lot, and particularly through the mobile networks, especially since the advent of 4G networks. And in fact, India is looking ahead to the 5G networks also very soon. But the 4G networks has really led to a spread of internet connectivity. In fact, it's now almost 8 years or more that the mobile internet connectivity has overtaken the desktop or the laptop internet connectivity in India. I think since June 2012, the transition occurred, and it's only going on increasing. So despite that, of course, the internet connectivity issues are there, bandwidth problems are there. So whatever systems are being developed, including that in the NDHM, they're also keeping a offline mode, a store and forward mode, rather than having everything in real time, because that may not be always possible from every part of the country. Next is what I would call a bottom-up approach. That means the end users, every individual, they are becoming aware and demanding to access their own healthcare data from anywhere in this global village. So there's a lot of migration, whether from one state to another within the country or across the countries and continents. But gradually there is a demand that wherever I am going, my record should be accessible, so that whoever is treating me at this point of time should know what have been my problems, or are there any specific indications or contraindications which are applicable to me, which would be very essential for treating at any point of time at any place. We can have a top-down approach of a legal mandate that it's mandatory and everyone has to use it. But this approach, I think, is better, and probably a mixture of the two will be working even better. And health outcomes are also improving because of this multifarious digital health interventions, often seamlessly. If the healthcare delivery teams are well connected, as I said, connectivity is getting into it. And the other is, of course, if the systems are interoperable. That's my favorite area. That is standards and interoperability. And standards are obviously essential if you really need to have. Otherwise, if we have disparate systems and silos, then most of the time we cannot actually get much useful information out of it, actionable information. And therefore, we cannot really make any information-based policy making. So one of the important things really needed for this is we need to build the capacity building of human resources. Again, this is an area which is very close to my heart. I've been an academician for more than 2 decades. But still, somehow or other, many of the policymakers are not still convinced that we really need people who need to be health informaticians or digital health specialists or health information specialists and so on. However, there has been a bill on National Council for Allied Health Sciences, that's the Allied Health Professional Bill 2018, which is trying to bring out this allied health professional discipline, including health information management. And when we have trained professionals, then getting digital data and ensuring the quality becomes easier. And that's, of course, very essential. It's a prerequisite. Without that, we can't really go ahead. If the data is not good enough, then whatever action we take based on that may not work well, which has been happening time and again during this ongoing pandemic. And this is another area where I'd like to stress that this is again a teamwork. It's not that any individual person or any individual discipline can do everything. So when we talk about health informatics or biomedical informatics and health informatics, so it is actually a combination of multiple disciplines, whether it's from the management science, the computer science, or the cognitive science, which are related all to the ICT, information communications technologies. Or you have the biological sciences, you have the chemical sciences, you have the cognitive sciences, you have the information sciences, you have the engineering, biomedical engineering, materials, mechanics, everything. And clinical sciences, public health, mathematics, all are really interacting with the other. So if you really want to have better health outcomes of the community, we need to work in a team. To make digital health a reality, really useful, we have to work in a team. It's not that always all the teams will need members from all these disciplines which are shown here. But wherever we are trying to achieve something useful, like a previous speaker, Dr. Uman John, very nicely pointed out, the sort of work that's going on in the realm of digital health is really mind-boggling. And for that, teamwork is absolutely essential. If you look at the skill sets which is required in this current age or the information age, so one of the standards is this SFIA, or the skills framework for the information age. So whether it's for the professional role or for the organizational role, the levels of responsibility gradually goes up. When one enters the organization and whichever professional role, initially everyone has to be on the learning curve and follow whatever directions come in. Gradually, as they go up, they become more skilled, subject specialist, and so on. They can apply, enable, ensure, advise, initiate, influence, and then set strategy, inspire, and mobilize. So that is how it goes on. It's not that I'm an expert in any domain and I suddenly come and join a team and I can be always at the top. It may not work. So this is, again, a very important area where I would like to stress. When we talk about teams, we also need to look at the professional roles and the organizational roles of all the individual team members. If we really think of getting something done properly, it's not just doing a thing, but doing the right thing and in the right way. So this is very common. Whatever a member of the team is saying, the other member thinks that's wrong, and both may be right. So whenever there's an interdisciplinary team where the languages are very different, there has to be a certain ground rules, like respecting each other's professions, forgetting the ego, then behaving with due dignity to other professionals, trying to understand the language and perspective of the other professionals. Then what often we tend to do is, if we don't understand something or we think it's wrong, it's not what I know, then we tend to sneer or jeer. This is certainly not good for teamwork. And integrity, again, is very important. Unless we have integrity, so the social and ethical values, these things also make a huge difference. So, like if you think of using artificial intelligence, machine learning, and other newer technologies for healthcare, for achieving digital health, we have to look at the ethical part also. In fact, when we talk about training, we look at it in three ways. Firstly, whether the teaching learning is being done in an ethical way. Then developing this technology-enabled healthcare, whether AI, ML, or any other technology, whatever is there. Whether the technology is being developed ethically. Thinking about the social effects. And thirdly, not just developing, but using. So even if some technology has been developed ethically and the training has been given ethically, but even after that, the person who's going to use it may not use it ethically. So using ethically. So teaching, learning, developing, and applying or using for technology in healthcare or digital health. All these needs to be done ethically. Otherwise, it may not really serve the purpose that we are looking for. So I come to the last slide of my talk, the take-home messages. The National Digital Health Ecosystem of India was envisaged through the National Health Policy 2017, and subsequently it was spelled out through the National Digital Health Blueprint, which came out in 2019. This blueprint is being implemented through the National Digital Health Mission that was launched this year on the Independence Day of India, it's 15th of August. Then, as I've already explained, the National Digital Health Mission Sandbox is providing opportunities to all for testing it, testing their own applications, seeing the compatibility, whether they're standards compliant or not, whether they work properly or not, whether they work with the system or with each other. The next thing which is needed, and this is where all of us need to work very hard and work well, is to provide the appropriate value proposition. That means better health outcomes. Then only we can overcome the barriers and challenges. There is a barrier of digital divide, no doubt about that. And of course, socioeconomic divide is also there. But it's the value proposition that matters. If a person who's entering the data gets back some information, some insight with which he or she can give better healthcare, that is also a good value. Value need not always be in pecuniary terms. It need not be just monetary incentives. But if someone gets useful information, actionable information based on which he or she can improve the health outcomes of the person in front of him or her, that itself is a good value proposition which we should all try to get from the system. And finally, and most important, as I said, I mean capacity building, but interdisciplinary teamwork. Often individually brilliant persons put together in a team may not be able to perform well. It's very important to go for this interdisciplinary teamwork for leveraging the benefits of through this digital health ecosystem. I think with this, I think I come to the end of the talk, and I'm open to questions. Over to you, Irfa.
Thank you. Thank you so much for the wonderful session. We have a couple of questions, and one of them is from Pranav Kumar, Hyderabad. He's asking, in rural India, RMPs are the first healthcare contact. What are the possibilities to train and repurpose them with positive mindset to use widely available resource pool for healthcare for all?
Absolutely. I mean, as I said, all sorts of community health workers, not just RMPs, even whether it's an ASHA, whether it's an A&M, whether it's the other health workers which are around. I think everyone needs to know. And as I said, I mean, it's the value proposition. Unfortunately, the diffusion of health technology is not so much because of this single factor, because everyone thinks, what's in it there for me? And as I said, whoever is the healthcare worker, the primary motive of him or her is to manage to alleviate the suffering of the person in front of him or her. And often getting some insight from the information, the data that has been input by the end caregiver is always useful. So we need to look at that. In fact, how best we can empower them with the information that they are gathering so that they can use it. And then that itself will incentivize to get for subsequent information gathering, more useful information for more people. And they would do it willingly rather than being forced, because often force works for some time, but that's never a long-term solution.
Thank you. And the other question is there any successful platform for GP to super specialist, live connect and consultation for rural or small towns?
There are multiple platforms. In fact, I think yesterday also the telemedicine registry was discussed. So you can go and have a look at, and according to your needs, affordability and everything, you can choose and pick from them. And sometimes, of course, you may need to customize because one size doesn't fit all. But it's more important, as I said, if you look at digital health or health information technology, there are three pillars. One is the tools or the technology. That is actually the easiest nut to crack. Next is the process or the workflows. But the third component is the most difficult one. That's the people. And it's the people who make it successful or make it a failure. So unless the people, and that brings back to my favorite topic again, capacity building of human resources. Unless human resources are trained appropriately, then however evolved the technology may be, we may not be able to leverage it to the best of the users' benefits.
Thank you. Thank you so much for your time, and thank you so much for your participation here. It was great having you back. It's a
It's my
homecoming
pleasure
for
as
you.
well.
Yeah, thank you. Thank you again.
Thank you and take care.
Thank you. Take care.